Hi everyone, my name is Ravi Sharma and I am here today to present my research on statistical evolution of emergency admission rates in NHS hospitals across weekday and weekends. This research is a part of my MSc in Cloud Computing at the University of Lincoln. NHS deliver essential emergency care services, although it faces concern regarding care quality variations during weekday as compared to weekends. The quality of healthcare during weekend frequently suffer from unequal staffing levels and resource allocation which can impact patient outcomes. This research aims to answer the question, do NHS hospitals experience different emergency admission rates on weekdays versus weekends? Based on this, I have formulated two hypotheses. Null hypothesis, there is no significant difference. Alternative hypothesis, there is a significant difference. Previous studies, such as those by Allen and Bell, have shown increased mortality rates for weekend admissions. These findings laid the foundation for my analysis for this study. I used a data set from NHS Digital covering records from 2022 to 2023, which includes 180 anonymous emergency admission records. I have applied statistical methods to analyze the data, including descriptive statistics, t-tests, ANOVA, chi-square test, and bootstrapping, as well as 2K HSD for post-hoc analysis. The data is GDPR compliant and open access, which means it is publicly available and ethically safe for use in research. The first key finding is the difference in admission rates between weekday and weekends. The weekday mean for emergency admission is 1436.67, whereas the weekend mean is 1313.79. This indicates that the number of admission is significantly lower on weekend, with a difference of about 122.88 fewer admission on an average. Next, we examine the statistical significance of this difference. The t-test showed a p-value of 0.0002, which provides strong evidence for a significant difference. The ANOVA test gives an f-statistic of 292.6 with a p-value of less than 0.0001, which is highly significant. The chi-square test yield a statistic of 13.49 and a p-value of 0.0012, indicating a strong difference in admission rates. In terms of effect size, the COAS-D is 0.73, which is considered a large effect, and eta squared is 0.62, providing strong evidence of a meaningful difference. Based on these findings, the analysis clearly showed that emergency admissions are lower on weekends. This difference is statistically significant with strong evidence against random variation. Now, based on this conclusion, I have some recommendations. To handle the lower admissions, there may still be operational challenges. So it's important to ensure that critical areas such as emergency rooms are sufficiently staffed during weekends. Improving access to diagnostic services and specialists during weekends will help reduce delay in treatment and improve patient care. While the study showed differences in admission rates, it did not analyze how these differences may affect patient outcomes such as treatment delays or mortality rates. Further research should explore how these factors may be influenced by the reduced admissions on weekends. Here we can see visual representation of the data trends that we have discussed, which highlights the differences in emergency admissions between weekday and weekends. The visualization helped to further illustrate the significance of the finding. Thank you for your time and attention. This concludes my presentation. I hope this study shed lights on the operational differences in NHS hospitals between weekdays and weekends.